Good morning. So it is approximately 5:45 a.m. My shift starts at 6. I get off tomorrow sometime tomorrow afternoon. So I have about 30 hours of a call here coming up. Today's Sunday, going until Monday when I get off. I looked at the OR schedule this morning, and there are already 5 cases that I need to do this morning. I do have some junior residents with me. There's one. There'll be an intern in the ER all day today, and a third year that kind of goes with me in the operating room. But the intern's job is to see the patients in the ER as they first come in. So if a patient comes in with a gunshot wound to their femur, he would go see that patient and work them up, which means get them ready for surgery, sign them up for surgery. If we need to do skeletal traction, which means putting a pin inside their leg and adding some weight to it to get their bones aligned. That helps with pain and also helps me in surgery because the bone is better aligned. He sees patients on the floor, and he consults from a patient's already admitted to the hospital, and say for instance they get an infection of their knee, or they figure out after a while that the patient has a fracture that was possibly didn't pick up the first time around or first couple days. But he sees all of that. He gets our list ready. He puts orders in for the patients. He goes to see patients in the recovery room to make sure they're okay after surgery. So it's a intern year. Second year is a busy year. So you definitely will be on your feet all day, and it's constantly moving. Very busy. In a given shift, a 12-hour shift, I'll divide it up in 12 hours. He may see maybe 10 new patients in the ER or the floor, and then for 2 shifts, he times that by 2. So the third year's job on this team is to help the intern, kind of teach the intern. The intern may not be comfortable doing certain things, and his job also is to operate. At nighttime, where there's nothing going on, he can go to sleep, but he's here 30 hours with me as well. And my job as a chief resident on trauma is to kind of make sure everything runs smoothly, make sure all the patients, I look over at all the patients and make sure everything's done that needs to be done. Going on for the day. So we usually start off the morning with rounds. That means we go to see patients on our list. Currently on the trauma surgery, I have about 60 patients that we divide up as teams, and we see them. We make sure that their pain is controlled, they have their medications, their home medications, that their surgical sites look fine. Patients that are going to surgery, we pre-op them, which means that we get them ready for surgery, get them consented, which means we get their permission, their signature, and we explain all the risks, benefits, alternatives to the procedure that we're going to be doing. And also we just check on patients who had surgery either the day or a couple days, or some patients are here for a week or 2 at a time. So that's what it's called when we mean rounding. I'm about to go see some patients. I have about 7 patients to see this morning, and then I'll be heading to clinic. When I'm on call as a chief resident, I'm in clinic during the day, and then after clinic is done, I go to the operating room for the rest of the night until the next morning. So clinic starts here in the next hour and a half or so. So here we go. So this is our cast room here, where patients come into clinic, and then they have fractures, or say for instance patients come into the doctor's office. So they come into this room. We have a cast saw and different cast techs who put the cast on for us, or take the cast off, put splints on. These are little cast bays right here, each little separate one right there. And we have another one here. So several cast bays where patients come in to the trauma clinic, and this is where we see them to make sure they're doing okay after their injury. So this is a suite here. This is basically where patients come in and they get x-rays, and it's right here in clinic. So we have an x-ray tech here in clinic that shoots our x-rays for us. And we can see their x-rays within a couple minutes after they shoot the film. So this is clinic. I'll be here till probably 1 or 2 o'clock, and then I will head to surgery. So this is hour number 8 or so. Got here around 5:45 this morning, and it's about 2 p.m. now. About to go fix a gentleman who broke his leg. He fell off a roof and then broke his leg. I have another, does that make it 22 hours to go, probably? So, just putting these booties on here that protects you, keep your shoes from getting blood and all other kind of stuff in surgery. Checking with you soon. So I just came outside to check out the helicopter. Whenever you hear that, it means there's a really sick patient that's coming into the hospital. They usually bring him in on the helicopter from kind of miles away, or even 200-300 miles away. So when you hear that helicopter, that means there's a really bad trauma coming in. So here we go.
Attention, vehicle is about to move forward. Caution, automatic vehicle approaching. Caution, automatic vehicle approaching.
So trauma is very unpredictable. It can change at any minute. There can be patients that come into the ER that require emergent surgery that are extremely sick, and your night can change in a minute. So it just depends. All right, what's up, everyone? It is about 1 a.m. in the morning. I just got to my call room. Essentially, it's a room in the hospital. It's actually, I have a patient that I'm kind of concerned about and kind of been watching kind of throughout the day today, who we did surgery on, and his room is right across the hall from the call room. So call room's up on the 10th floor, and it's essentially a room where residents, surgery residents, or we can sleep if there's nothing going on. The last couple call nights have been so busy that I haven't been able to get any sleep. I was working essentially 30 hours straight, and I think one of the call shifts we did like 9 surgeries that entire day. So busy days, but it's always good to have a couple minutes when you have a couple minutes where you can just relax and kick back and possibly get a couple hours of sleep. So hopefully it stays quiet tonight. Tonight I have on my team, there's a third-year resident that's with me, and also a intern that's in the ER. The intern will call me or wake me up if there's something that is emergent that needs to go to the operating room, like a bone that's sticking out of someone's leg or arm. We call that an open fracture, or any other emergent case that needs to go to surgery tonight. Otherwise, I will be getting some sleep tonight. Hopefully that is the case. But let's look around the call room. So essentially, I have the phone here just in case I get paged and I need to call down to the ER, to the operating room. Use that phone there, or my cell phone. There's a computer with essentially a desk. Always good to have some Gatorade to stay hydrated. You can easily get dehydrated on trauma, long hours. It's hot in the operating rooms at times. You do a lot of sweating. In orthopedics, it is very physical, a lot of hands-on surgery. So chair, a desk with a lamp that doesn't work, and essentially my bed. So this is essentially the call room where I will sleep at. Hopefully I'm about to lay down for a couple hours, and I will set my alarm for 4:30 a.m. I need to go see some patients early in the morning and do some other things, make sure things are squared away for surgeries tomorrow. But I will. This is where we sleep at. I'll check in with you guys shortly. 6:45 a.m. Just saw some patients. Got a coffee. Have a few more things before I get out of here. Hopefully get out of here in 3 to 4 hours. So check in with you soon. All right, so I just left the trauma bay, which is we call it the trauma bay. It's an area where all the patients that come in through the ambulance or helicopter that are really sick or have lots of injuries, they come in through the ER. And just saw several patients that were motor vehicle accidents, and also MV versus pedestrian, means get hit by a car or kind of falling off of kind of high objects such as a bridge. There's several consults, which means the general surgeons called us to see these patients who had multiple injuries. And when this happens, so you have to look at all their scans, their CT scan, their x-rays, their chest x-ray, look at their pelvis. You want to make sure they don't have anything that could potentially lead to a lot of bleeding and where they can become unstable. We're taking spine trauma call today, which means we see patients that have spine injuries. There's several patients that we got called on last night that have injuries to their spine as well, that will need to go to surgery to fix their spine. Their fractures are unstable. So it can be quite overwhelming. There is a lot of things going on in the ER, which in the trauma bay right now. So it's pretty hectic. A lot of noise, a lot of chaos, a lot of things are going on. But the main thing is you have to stay organized. You have to work as a team, help each other out. There's 3 of us here last night, a first year, a third year, and then I'm the chief resident that was on last night. So, but definitely a busy night, but it was a lot of fun, and we'll check in with you guys soon. All right, I am just now leaving work. It's about 11:15 a.m. Almost lost track of time. I'm exhausted. It's been a long night, but it was a lot of fun. We were extremely busy last night. Lots of traumas. I think we did total maybe 7 or 8 surgeries throughout the day yesterday, which is a lot. Some of the surgeries were 3 or 4 hours. So it's a busy day. So what happens next? I need to sleep. That's what happens next. I'm going to get some sleep, and then I wake up, and then I study, go to the gym, and then usually on trauma surgery we have 1 day off a week. So, and it's usually one of the weekdays, either Friday, Saturday, or Sunday. Tomorrow's Saturday, so it's my day off, and then I'm back at work again on Sunday. That's the 3rd day. Sunday, yep, for another 30-hour shift. So every 3 days, 30-hour shifts. 1 day off a week. Long hours, brutal weeks. I'm exhausted. I need to rest up and catch up on a lot of things I kind of neglected during the week, but it was a lot of fun. Life as a orthopedic surgery resident on trauma, definitely one of our busier rotations. Definitely can be stressful at times. It can be overwhelming, but you just got to keep your head up and keep moving forward. But thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss these videos. We'll see you next time.